Hello everyone, I'm Dr. Jason Fung. Here's a mistake that millions of seniors make every single day, completely unaware that it's harming their kidneys. They drink milk, regular cow's milk, because they've always been told it's healthy, but for aging kidneys, it can actually be the worst thing on the table. The problem isn't milk itself, it's the type of milk. The most common variety that almost everyone drinks daily, cow's milk, is high in phosphorus and animal protein. These two components force your kidneys to work much harder and slowly drive your creatinine levels up over time. Today, I'm going to show you 3 kidney-friendly milks that can help reduce inflammation, support your body's natural cleansing processes, and when combined with the right daily habits, may even help bring your creatinine levels back down. These aren't complicated. They're not expensive. And most of them you can find at any regular grocery store. So if you're a senior or you're caring for one, stay with us. What comes next could genuinely make a difference in your health. Number 1, unsweetened cashew milk. Now, this one tends to raise a few eyebrows. Cashew milk from nuts? That doesn't sound like something a kidney patient should be drinking. But here's the thing. It's not about where it comes from. It's about what's actually in it. And when you look at the numbers, unsweetened cashew milk has one of the most kidney-friendly nutritional profiles of any milk alternative out there. Let's break it down. First, phosphorus. You already know why this matters. Too much phosphorus in your blood puts serious strain on weakened kidneys and can lead to bone loss and dangerous calcium deposits in your arteries. Cow's milk contains over 250 milligrams of phosphorus per cup, and your body absorbs nearly all of it. Unsweetened cashew milk, typically between 30 and 60 milligrams per cup. That's a dramatic difference. And because it comes from a plant source, the phosphorus is naturally less absorbable than the kind found in dairy or processed additives. Less absorbed means less your kidneys have to deal with. Advanced kidney disease makes it hard for your body to clear potassium from your blood when levels get too high, a condition called hyperkalemia. It can trigger dangerous heart rhythm problems. A cup of cashew milk contains roughly 60 to 100 milligrams of potassium. That's well within the manageable range for most chronic kidney disease patients, and it gives you the flexibility to stay within the daily limits your nephrologist recommends without cutting out a satisfying drink entirely. Sodium is another win here. Unsweetened cashew milk is naturally low in sodium, which directly supports blood pressure management. High sodium causes fluid retention, and that extra fluid increases pressure on the nephrons, the microscopic filtering units inside your kidneys. Choosing a low sodium milk is a quiet but consistent way to protect what kidney function you still have. Here's something that doesn't get talked about enough. The type of fat in cashew milk. It's rich in monounsaturated fats, specifically oleic acid, the same heart-healthy fat found in olive oil. People with kidney disease face a much higher risk of cardiovascular complications. These fats help support a healthy lipid profile without the saturated fat load you get from whole dairy milk. Healthier blood vessels mean better circulation to your kidneys, and that matters more than most people realize. And just like rice milk, cashew milk is very low in protein, usually under 1 gram per cup. For patients on a protein-restricted diet, this is genuinely valuable. Your limited daily protein allowance should go toward high-quality sources that give your body essential amino acids. A glass of cashew milk won't eat into that budget. Now the warning label you need to read before you buy. The cashew itself is kidney-friendly, but what manufacturers do to it during processing can change everything. Many brands fortify their cashew milk with calcium phosphate or other phosphate additives to make the nutrition label look more impressive. For your kidneys, those synthetic phosphates are absorbed at nearly 100%, completely canceling out every benefit we just talked about. Before you buy, flip the carton. Look for ingredients like tricalcium phosphate or dipotassium phosphate. If you see either of those, put it back. What you want is clean, unsweetened, non-fortified cashew milk, and even then, stick to around 1 cup per day, because even kidney-friendly foods can add up if you're not paying attention. Hey, Are you still here? Do me a small favor. Drop the number 1 in the comments right now. Just the number 1. That tells me you're still here. And honestly, it helps this video reach more people who probably need to hear this, too. Number 2. Rice milk. Let's start with the one that surprises most people. Rice milk. Not oat milk, not almond milk, but rice milk. And there's a real reason kidney specialists keep coming back to this one again and again. When your kidneys are under stress, every single mineral you consume has to be filtered out. And rice milk, specifically the unsweetened plain variety, puts almost zero burden on that entire process. Think of it as giving your kidneys a well-deserved day off. Here's what that actually means for your body. Phosphorus is one of the biggest threats for people with kidney disease. When your kidneys can't clear it fast enough, phosphorus builds up in your blood, a condition called hyperphosphatemia. And when that happens, your body starts pulling calcium out of your bones to try to balance things out. Over time, that displaced calcium doesn't just disappear. It deposits into your heart and blood vessels, increasing your risk of serious cardiovascular complications. Cow's milk carries a heavy phosphorus load, and your body absorbs nearly 80 to 100% of it. Rice milk is different. It contains significantly less phosphorus, and the small amount it does have is harder for your body to fully absorb. So less phosphorus actually reaches your kidneys in the first place. That's a meaningful advantage, not just a small detail. Then there's potassium. 1 cup of regular cow's milk contains around 300 to 400 milligrams of potassium. Rice milk sits at roughly 30 to 60 milligrams. That's not a minor difference. That's a completely different category. As kidney function declines, potassium can build up in your blood and disrupt your heart rhythm. For seniors whose kidneys are already working at reduced capacity, choosing the lower potassium option every single day adds up to real, measurable protection over time. Sodium is another important factor. Rice milk is naturally very low in sodium, which directly supports healthy blood pressure control. This matters because high blood pressure is both a cause and a consequence of kidney disease. It's a vicious cycle that's hard to break. Keeping your sodium intake low helps reduce fluid retention and eases the mechanical pressure on the tiny filtering units inside your kidneys, called glomeruli. And since chronic kidney disease patients already face a higher risk of heart disease, it also helps that rice milk contains zero cholesterol and very little saturated fat, unlike whole or even reduced fat cow's milk. One more point that often gets overlooked: protein. When your body processes protein, it produces nitrogen-based waste called urea. Your kidneys then have to filter that out. In the later stages of kidney disease, reducing protein intake is one of the key strategies doctors recommend. Rice milk has almost no protein, around 0.5 to 1 gram per cup. That's the lowest of nearly all milk alternatives, which means almost nothing extra for your kidneys to process. But here's the warning you absolutely need to hear before buying anything. Not all rice milk is safe for kidney patients. Many commercial brands add something called calcium phosphate to fortify their product, to make it look more nutritious on the label. For a healthy person, that sounds like a bonus. For someone with kidney disease, that single ingredient can turn a safe, kidney-friendly drink into a high-risk one. Always flip the bottle and read the ingredient list. What you want is simple, unsweetened, non-enriched rice milk. No added phosphorus, no added minerals. Just clean, plain rice milk. And your kidneys will thank you for it. Number 3, flax milk. We've saved something special for last. Rice milk and cashew milk are both great for what they don't contain: low phosphorus, low potassium, low sodium. They protect your kidneys by staying out of the way. Flax milk does all of that too. But then it goes a step further. This one doesn't just reduce the burden on your kidneys. It actively works to slow the damage down. And for seniors dealing with chronic kidney disease, that's a meaningful difference. Let's start with the basics. What kidney specialists call the low 3 rule. Any beverage that's safe for kidney patients needs to be low in 3 things: phosphorus, potassium, and sodium. Flax milk clears all 3 with room to spare. Phosphorus. Flax milk contains almost none. Unlike soy milk, both of which carry significant phosphorus loads. Flax milk is one of the safest options available for people trying to keep their blood phosphorus under control. Potassium. A cup of flax milk typically contains somewhere between 0 and 30 milligrams. Compare that to cow's milk at around 300 milligrams, or even almond milk at roughly 100 milligrams. Flax milk is barely even on the scale. For seniors with strict potassium limits, that kind of number gives real breathing room. Sodium. Unsweetened flax milk is naturally low, which helps manage blood pressure and reduce fluid retention, two things that directly affect how hard your kidneys have to work every single day. So far, so good. But here's where flax milk separates itself from everything else. Flax milk is one of the only milk alternatives that contains a meaningful amount of alpha linolenic acid, or ALA, a plant-based omega-3 fatty acid. And for kidney patients, that matters more than most people realize. Chronic kidney disease is, at its core, an inflammatory condition. The damage doesn't just come from high creatinine or blocked filters. It comes from ongoing inflammation that slowly breaks down kidney tissue over time. Omega-3 fatty acids like ALA help reduce that systemic inflammation, which research suggests may actually slow the progression of kidney damage when consumed consistently. There's a cardiovascular angle here too. Kidney health and vascular health are deeply connected. In fact, heart disease is the leading cause of complications in chronic kidney disease patients. ALA supports something called endothelial function, which is essentially the health of the inner lining of your blood vessels. Healthier vessels mean better blood flow to your kidneys, and better blood flow means better filtration. On top of all that, flax milk contains virtually zero protein and virtually zero cholesterol. For pre-dialysis patients on a low-protein diet, 0 grams of protein per serving means your kidneys aren't processing any additional nitrogen waste from this drink at all. And with only around 25 to 50 calories per cup, it won't interfere with weight or blood sugar management either. But, and this is important, two warnings before you go shopping. First, the phosphate additive problem. Many flax milk brands add tricalcium phosphate to boost their nutrition label. For a kidney patient, that synthetic phosphorus is absorbed at nearly 100% efficiency. It completely cancels out everything we just described. Check the ingredient list every single time. If you see any word with phosphate in it, choose a different brand. Second, and this one is for dialysis patients specifically. Zero protein is a benefit before dialysis, but once you're on dialysis, your protein needs actually increase. If you're in that stage, flax milk alone won't meet those needs. Talk to your renal dietitian about how to balance it with high-quality protein sources. So there you have it. 3 milks that are actually working for your kidneys, not against them. Rice milk for its incredibly clean mineral profile. Cashew milk for its heart-friendly fats and low potassium load. And flax milk for going one step further, actively reducing inflammation and supporting your blood vessels from the inside out. None of these are miracle cures, but small, consistent choices, like switching the milk in your morning routine over weeks and months, that adds up to real protection for your kidneys and real improvement in how you feel day to day. If your creatinine has been creeping up, or your doctor has mentioned early kidney concerns, start here. These are simple swaps, not sacrifices. If this video helped you today, please hit the like button. It's the simplest way to tell us that this kind of content matters. And if you know a senior, a parent, or a friend who's dealing with kidney issues, share this video with them. It might be exactly what they needed to hear. Thanks for watching.